Hey, Pushnet, new little video. This one is to continue for the medical bag. So on this topic right now, we're going to talk about abdominal pain, and mostly. So how I separated the protocol is in two sides. For female and male, because obviously the issues are a little bit different. There's things that are still similar, that you have an appendicitis for male or female. It's an appendicitis, but there's things, especially for example pelvic pain. Male won't really have that kind of problem. So I'll show a little bit the kit that I made up, and we'll show up the presentation maybe in two parts. First part will kind of explain what's included in the kit, and the second part will be the kit himself. So the kit basically fit in this little bag here, and there's still missing stuff, but I'll explain a little bit through the philosophy. So the first thing important for female is what I call the double dip, and to have in your kit some pregnancy tests and urine tests. So in the females problem, there'll be kind of two big categories. The pregnant women will have their own issues at it, and the second one will be more the general idea. So for example, in the double dip, if you have a pregnant woman that didn't know that she was pregnant and she's presenting with certain type of pain, she could have an ectopic pregnancy, and so that was one that you would maybe try to go to a hospital even if it's bad, because ectopic pregnancy, if they go bad, you're in deep trouble. Another one here, for example, for pregnancy, if they have a protein in the urine, sometimes shown, depending on where they are in the trimesters, it could be complications like preeclampsia or things like that. So that's why with those two tests, there's a lot of information you can do. They're very easy to buy. You can buy this at a pharmacy for the urine, and a pharmacy again for a pregnancy test, and they're very easy to do. All you need is a little bit of urine. So another things too is the resource for you to have. And I'll put links below, but basically in your kit, I have a card here. The ALSO stands for the Advanced Life Support Obstetric, and this is basically, it's a 2-day course on what to do in case of emergencies and stuff, and there's a little card that comes with it. This is what the card is, and again, when I do the video about the kit himself, I'll talk, and people can purchase that. They're like they're have $11, but they're very well done. They have a lot of information, and even if you never had to do it, then at least you have some information, especially if you're expected. If you're having, like right now you're pregnant or something, that would be something that they have. They also sell like a poster, so that could be a place that you could put in your room or have in your kit, so that way you could put that on if something happens. Obviously for books for midwife, awesome books, the same people that did When There's No Doctors. So it tells pretty much a professional how to treat people with obstetric issues or pregnancy issues, and they go very in details. And this over here could be important, because especially in books like midwife and stuff, they'll tell you to do vaginal exam. And so here is a little pocket dilatation guide. So but it basically, because they'll say there's like 1 finger, 4 fingers and stuff, and to help you with your cysts. So it's to know about your cervix and how they're dilated. And so basically what you do is you apply your fingers. So you take your test, then you apply your fingers to the dilatation guide, and it'll tell you where you're at. And again, we're talking about not first aid. You won't do that in the middle of the street, but if you want a decent self-reliance kit for pregnancy issues, because that would be one of the big categories. I think at minimum that should be hit, plus a delivery kit, so which they can be purchased. Here's the little table that I found on the internet that kind of what we call a differential diagnostic. So a differential diagnostic is like when you present yourself, let's say I have pain in my abdomen. Well, when you show up to a healthcare professional, they'll separate it in different sizes. So what could be causing this? So for this is specialized for women, and basically what it is you divide it in different categories. So gastrointestinal, like I was telling, that's a little bit the same thing that man or woman would get. Appendicitis, bowel obstruction, all those can happen to both sides. Gynecologist, that's only for female, and so that would be a very a specific thing for them. Urinary can happen to both, but a woman will have certain categories that the man won't have. Pregnant women and stuff. So all here you have pretty much the cause that you have. So my intention is to make like a little cards like this of those printable table, so that it kind of, when I do my assessment, kind of gives me ideas of what to look for. In here, what they did is that it's the clinical clues, and so basically now, okay, it looks like it's probably a gynecologic issue, and I got dysmenorrhea, so that means it could be either an endometriosis or uterine fibroid. Again, this is not for people to play little doctors and to self-diagnose themselves and not to go to the hospital when the grid is up and everything. Is to give tools to people so that if something happens and let's say it's a flu pandemic and the hospital are overwhelmed and everything, to take a decision, how risk benefits is it for me to go over there? So with those stills, if you, for example, if you have an ectopic pregnancy, there's no way you can operate that at home. You cannot take care of that just by watching a YouTube video. There's no way you can do that. So that you need help. How are you going to get that help? That's what this thing is for. So like, should I go grab help, and how much do I need to help? Like how much would that risk benefits do, so that it can help you take decisions. So they're decision tools. They're not tools to diagnose people when the grid is up and stuff, so that you don't go to the hospital. It's to have an understanding to take a better decision. That's the purpose of things like that. Vaginal bleeding here, all the different styles. So for example, if somebody, so that's kind of the question you'll be asking, do you have any abdominal pain? That's why the double dip right from the start. So if there is a pregnancy, boom, they go into the category of the pregnant people, and so then you can take the tools to kind of do the differential diagnostics about that. So the most likely issues for females are so we took care of the pregnancies, a different beast on his own, and books would be better and stuff, but the most likely issues from let's say 80% of female that are non-pregnant would be probably those ones: vaginitis, premenstrual cramp, and all those goodies. UTI, which stands for urinary tract infection. PID, which stands for pelvic inflammatory disease. And STD, which is the sexual transmission disease. So vaginitis, so it's an inflammation of the vagina that results in discharge, itching, and pain. There's different cause of it. So there's bacterial vaginitis, there's yeast infection, and there's other stuff as well. One that I wanted to point out is the yeast infection. A lot of people talk about having antibiotics in their kit and stuff, but I never hear anyone really having a tube of for yeast infection. The beauty with having a tube, like you go to the pharmacy to and I wouldn't have, obviously I would take the cream, and here's one of the reason is that just like my first aid kit, I always try to make them just like any other kits, is that they have to have multifunction. If you take the cream for the yeast infection, because it's a yeast infection, athlete foot, people that would have like, you know, either like they're very sweaty or something, you could develop some yeast infection inside your place where you sweat a lot and things, and so the skin could kind of become irritated for that. You could try to use that cream because it's there to call the fungus Candida albicans, since a lot of time that fungus will be a cause of most of the yeast infection that you have. It's just in this case it's in the vagina. So having two of that cream can have multiple use. So that's why I was talking about that. Dysmenorrhea, it's basically menstrual cramp that are treatable. So that means like you have a lot of your periods are more heavy than usual. You have like a lot of cramps that you cannot handle anymore. So there's prescription drugs. So like Tylenol, Advil, ibuprofen. My understanding is that leaves seems to be helping people a little bit more than just Tylenol. Some people Tylenol does do anything because it's more an inflammatory process. So the leaves seems to be working a little bit better. And there's also another things that can help dysmenorrhea. So if you don't have your drugs, or you want to try, studies have shown that exercise may have help. So heat, soaking in a hot bath or using heating may help. There's some dietary supplements like fatty acid, vitamin B1, B6, magnesium, omega, vitamin 3, and one that some people have, because again I don't have that issue, but some people have tell me that it works good, is raspberry tea. So apparently it really helps. So this is what I'm gonna have in my kit for the non-medical part. The reason for the non-medical is that if I have at the same time someone that just have cramp, but versus the other one that broke his leg, resource dependence, I may have to use the drugs towards one person and the other one try other stuff. Obviously maybe I'm gonna get my head chopped because the other person is in her period. I may use the drug for my own safety. But the tea is easy to carry, is good, and I heard it works for a lot of people and stuff. So that's what I'm going to be carrying in this kit. Also, so here's where it talks also TENS, so transcutaneous electrical nerve stimulation.